Most men over 60 don't realize that their approach to self-care, including masturbation, may need some adjustments as they age. So, what is the correct way? Hi, I'm Dr. Laura Stone, a urologist with over 2 decades of experience helping men understand and adapt to the changes their bodies go through as they age. As men age, several physical and hormonal changes begin to influence not just your sexual performance with a partner, but also your private, solo experiences. One of the most well-known changes is a natural decline in testosterone. This hormone plays a significant role in libido, energy levels, and sexual function. But it doesn't act alone. Blood flow also begins to decrease, especially to the smaller vessels that support healthy erections. This means it might take longer to become aroused, or you may find it harder to maintain an erection during self-stimulation. Another common experience is reduced nerve sensitivity. Over time, the nerve endings involved in pleasure and sensation may become less responsive. This doesn't mean pleasure is no longer possible. It simply means the pathway to pleasure may be different than it once was. Now here's where it gets interesting. A 2022 study from the Mayo Clinic looked specifically at how men over 60 experience and maintain a healthy sense of sexual well-being. The researchers emphasized that men who created time and space for relaxation, instead of rushing or trying to force performance, had much more positive outcomes. Another respected voice in the field, Dr. Andrew Goldstein, has written extensively on this topic. He encourages men to view masturbation as part of their broader self-care, no different than stretching, sleep, or hydration. According to Dr. Goldstein, comfort and pacing are not luxuries. They are essential ingredients for maintaining a healthy, fulfilling connection to your body as you age. That reframing is important. Too often, older men assume that if something feels different or takes longer, it must mean something is wrong. But the truth is, much of this is expected. It's not a disease. It's not a problem to fix. It's a change to understand and gently work with. Let's shift our focus to something equally important: how you create the right environment for self-care. Because here's the truth. For many men, especially after 60, the experience of self-pleasure is just as much about mental and physical comfort as it is about stimulation itself. Creating the right setting helps reduce tension, increase comfort, and allow you to stay present with your body's sensations. So let's talk about what that actually looks like. First, start with privacy and peace of mind. You might think this is obvious, but even small interruptions, noises, distractions, the worry of being walked in on, can activate a mild stress response that pulls you out of the moment. This is especially important for older men because the body's natural arousal response is already slower. Any added stress or discomfort makes it harder for blood to flow and for the nervous system to shift into relaxation. Now here's something many men aren't told. Lubrication becomes essential after 60. As testosterone declines and circulation changes, the body's natural lubrication decreases. Not just for women, but for men too. Dry skin, decreased elasticity, and reduced moisture in the genital area can all contribute to friction, discomfort, or even micro-tears if stimulation is too dry or too aggressive. And here's a helpful tip: apply the lubricant before you feel fully aroused. This allows the skin to soften and warm up, and it helps your body interpret the sensations more positively from the start. For many men, this small shift, lubricating earlier, can reduce tension and increase overall responsiveness. Beyond the physical tools, though, is the mental environment. It's important to release old expectations. The mindset that says things have to look or feel a certain way, or that climax should be the primary goal, can create unnecessary frustration. Self-care after 60 is less about achievement and more about exploration. Some days may feel more satisfying than others. Allowing the experience to unfold naturally, without rushing or judging, is often the key to rediscovering pleasure in a way that feels grounded and nourishing. This might mean spending more time on arousal without the need for a climax. Or it might mean exploring different kinds of touch, different positions, or even new tools like warm compresses or textured sleeves designed for older men. If that feels unfamiliar, that's okay. These aren't signs of decline. They're signs of adaptation. Let's also acknowledge something that deserves more attention. You have every right to enjoy self-care without apology. This is not just a younger man's game. In fact, for many men over 60, masturbation becomes a calming, centering ritual, a way to stay connected to their body, regulate stress, and support hormonal and pelvic health in a safe, private way. Pleasure is a lifelong experience. The method may change, but the value remains. Now that you understand how to create a more comfortable environment for self-care, let's talk about something many men don't realize they need to update: technique. Most men continue using the same approach to self-stimulation they've used for decades, often fast, firm, and focused on climax. But after 60, this method can become less effective and sometimes even uncomfortable because your body has changed. And that means your technique should change too. Let's start with pressure. Over time, the skin and tissues of the penis naturally become thinner and more sensitive to friction. Combine that with reduced natural lubrication, and what used to feel good can start to feel irritating or even painful. That's why one of the first things I recommend to older patients is to lighten their grip. Try using a gentler touch. Not just to avoid discomfort, but because your nervous system is more responsive to subtle, consistent signals rather than intense, fast ones. Now here's the part most men overlook: speed doesn't always help. In fact, faster movement can actually reduce arousal when your nerve sensitivity has declined. The reason is simple: when stimulation is too quick or aggressive, the brain can't fully process those signals, especially if your nerve response time has slowed. Think of it like this. Your body is like a radio tuned to a slightly different frequency now. The old signals still work, but they need to be adjusted, slightly slower, slightly softer, to come in clearly. Another shift you might notice is in the pathway to pleasure. Many men over 60 report that the buildup takes longer and that the experience feels more muted. This isn't a sign of failure. It's a shift in how arousal happens. It's less like a spark and more like a slow burn. And if you give it time, that burn can be just as satisfying, sometimes even more so, than a fast climax. That's why patience becomes so important. You may find that your arousal builds in waves, coming and going rather than progressing in a straight line. When that happens, don't force your body to keep going. Instead, pause, breathe, and let your system reset before continuing. Now, let's talk about positions. After 60, flexibility, circulation, and pelvic floor tone can all affect how certain movements or angles feel. If you've noticed discomfort in your back, hips, or thighs during self-care, try experimenting with different body positions. Reclining with support behind your back, lying on your side, or propping up your legs slightly can all reduce strain and improve blood flow. Something else worth mentioning: some men benefit from using aids designed to increase comfort or sensation. These might include textured sleeves, warming lubricants, or soft manual tools that allow for varied pressure without strain. While not necessary for everyone, these aids can help you rediscover sensations you may have thought were gone. So here's what I want you to remember: gentle is better. Use a light grip and softer movements. Slow is stronger. Allow your body time to respond. Rushing often leads to frustration. Breathe and pause. It's okay if arousal comes in waves. Stay present, not pressured. Adjust positioning. Comfort leads to better blood flow and better results. Listen to feedback. If it doesn't feel good, stop. You're in control, not on a schedule. These adjustments aren't just physical, they're psychological. They send your body the message that this is about comfort, not performance, pleasure, not pressure. And for many men, that's where the real breakthrough happens. Not in getting back what once was, but in discovering what's still possible right now. Let's talk about when it might be time to check in with a doctor and how to approach that conversation with clarity, not shame. First, it's important to say this out loud. Needing help doesn't mean something is wrong with you. It doesn't mean you're broken. It means your body, like all bodies, is changing, and it deserves support. In fact, the men I worry most about are not the ones who come to me with questions. It's the ones who stay silent, thinking they should just deal with it, or that these changes are a personal failure. They're not. So let's talk through some of the most common reasons men over 60 choose to see a urologist, and how doing so can actually improve your experience with self-care and intimacy. The first sign is persistent discomfort, especially burning, stinging, or aching sensations during or after masturbation. Occasional sensitivity is usually nothing to worry about, especially if you're adjusting technique or products. But if you notice ongoing pain that doesn't go away with gentler touch or proper lubrication, it could be a sign of skin irritation, a small infection, or even a circulation issue. Next is changes in erection quality, not just during intimacy with a partner, but in your solo experiences as well. If you're consistently unable to achieve or maintain an erection in private settings where stress should be minimal, this may signal an underlying vascular issue or hormone imbalance. And early intervention, whether through lifestyle changes or doctor-monitored therapy, can make a meaningful difference. Another reason to speak up is numbness or significant loss of sensation. Some reduced sensitivity is expected with age, but if you suddenly feel disconnected from stimulation or notice that previously pleasurable areas now feel dull, this could reflect nerve involvement. Addressing this early can prevent further loss and help you maintain healthy function. You should also talk to your doctor if you've been feeling emotionally disconnected from your body, or if frustration, worry, or embarrassment have become part of your self-care routine. Your sexual health isn't just about mechanics. It's about confidence, comfort, and connection. A good doctor will understand that. And if they don't, it's okay to find one who does. Now here's what often surprises men. You don't need a serious medical issue to benefit from professional support. Sometimes, a 30-minute conversation with a urologist can give you clarity, reassure you that what you're feeling is normal, or introduce simple tools you hadn't considered. And that conversation often opens the door to better communication with partners, better understanding of your body, and more confidence in your private routine. So, how do you bring this up? You can start by saying something like, "I've noticed some changes in how things feel during self-care. I'm not in pain, but I'd like to understand if what I'm experiencing is part of normal aging, or if there's something I should be aware of." This frames the conversation as proactive and health-focused. It shows your provider that you're taking your body seriously and that you're not afraid to ask questions. And if the word masturbation feels awkward, you can simply say self-care or solo intimacy. Most experienced providers will understand what you mean and will meet you with respect. If you'd rather start the conversation indirectly, bring up symptoms like reduced sensitivity, discomfort, or concerns about blood flow. These are all legitimate clinical topics, and they're great ways to begin a more open, productive dialogue. And remember, you're not the first man to bring this up. Every urologist who works with older men has these conversations regularly. Let's recap the key takeaways. Persistent pain, numbness, or loss of sensation is a reason to check in with a provider. Big changes in erection quality, especially in private, shouldn't be ignored. Emotional distress around these changes is just as important as physical symptoms. You don't need to wait for a problem to benefit from a doctor's guidance. And every man deserves to understand his own body without judgment, shame, or silence. If your goal is to maintain comfort, connection, and a sense of ease in your private routine, reaching out for support is a smart, proactive choice. It doesn't make you less of a man. If anything, it shows you're ready to work with your body, not against it. And if that's something you value, keep going, keep learning, keep asking questions. Because your health doesn't stop being important after 60. If anything, it becomes more meaningful than ever. If this video helped clarify how to approach self-care after 60, consider subscribing for more expert guidance on men's health, intimacy, and aging. And as always, talk to your doctor before making any changes to your health, lifestyle, or daily routine. And remember, all information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.